Good morning, everybody. I'm Bob Sanborn, President and CEO of Children at Risk. We have an exciting new study that we're going to share with you guys this morning. Let me introduce the panel here for the press conference. First off, Sharon Jones is with us. Sharon is the Chief Equity Officer and the Director of the Texas Racial Equity Collaborative at Children at Risk. Also with us is Kendall Nuno. Kendall is the Executive Vice President and General Counsel at Mattress Firm. Mattress Firm has been a key part of this study. Very interested, of course, in sleep. Sharmali Roy is with us. Sharmali is the Director of the Center for Social Measurement and Evaluation at Children at Risk. Welcome, Sharmali. Also, Kimberly Darda is with us. She is the Senior Director for Head Start at Baker Ripley, the mighty nonprofit here in Houston. And with us, Guadalupe Fernandez. Guadalupe is the head of the Children's Immigration Network. She and I will be at Children at Risk, and she and I will be talking a little bit in Spanish about the study as well. The important thing for all of us to know is that sleep is important. And remember when Mom said you have to get your sleep because it's going to determine your success? Mom was right, but we didn't always pay attention to Mom, did we? And I feel like this is how a lot of us feel about sleep now, is that we know for children that it's important, and we know for their success it's true that they need good sleep, but we don't always pay attention to what's very clear for us. What we've done today is we've done a study that shows that there's a significant portion of children in the state of Texas and here in Houston that aren't getting good sleep. And we know that that's going to have an adverse impact on their success and the success of Texas. We've done a series of maps that we're going to be able to show where in our city, where in our state that there is sleep insecurity. And so we're going to look at these maps and we'll see zip code by zip code where there are indeed sleep deserts across our state and where we know that families are having a tough time. Study after study around sleep show that for children, they're not getting enough sleep. And this has an adverse impact on their health. Many children are overweight because of sleep. Many children have mental health problems because of this sleep. We also see that kids are much likely to engage in risky behavior when they don't get that sleep. And all of us know that we could be cranky when we don't get sleep. It's no different for our children, and their success is severely impaired by this lack of sleep. Moreover, a lot of studies are finding that pediatricians, understanding the importance of sleep, are still not using sleep as an important part of their well visits with kids as they do their regular checkups. In terms of public policy, we know that a lot could be done to really enhance the success of our children through sleep. Everything from focusing on issues of poverty to doing things like making sure that we don't have big time changes in the middle of the year. And we'll talk a little bit more about that. Our methodology was pretty in-depth. We looked at 11 different variables as we looked at where sleep insecurity lied within our cities. We looked at family and child poverty, rate of shift work of the parents, crowding in the homes, the mobility rate, student homelessness. We also looked at health factors like obesity, mental health, food insecurity and hunger, the disabled child population, and also where kids were working, where was that youth workforce? And that's how we came up with these maps. We have a slide of one of the maps here of Houston that we'd like to show you, if we could share that. And what you can see with these slides, that by zip code, we see that there's some really high risk zip codes, and we'll try to get that slide up for you later. What should parents be doing around this? This is very important. There are a set of basic simple rules, science-backed, that parents need to be following to make sure that their kids are getting good sleep. We know that parents are that first line of defense, right? The sort of the first responder to the life of children. And so we want to make sure that parents are following these rules. Number one, setting a bedtime is very, very important. A regular bedtime that you're consistent with. The other thing we really recommend is to calm children down, reading a book or singing with them right before bedtime. It could be the same book. As a matter of fact, many kids want that same book all the time. And so that's going to be another important thing for parents. Next is, and here's this map that we talked about. So when we look at these maps, you see a map of Harris County, and you see that these darker areas are these sleep deserts that we're very, very worried about. And there's an overlap, of course, with poverty because of a lot of these factors. So thanks for the map. Now we'll go back to those recommendations for parents. Reading a book together, very important. Also encouraging people to take a walk together. Physical activity is an important part of making sure that children get good sleep. We can go ahead and take the map off, guys. Thanks. And then also eating dinner together. We're recommending, right, because of food insecurity, we want kids to eat dinner together. Keep it cool. Make sure that the room that kids are sleeping in is cooler. Stay away from some of the screens. And for babies, always follow some of the safety recommendations that your pediatricians give. In terms of policy, a couple of good recommendations in terms of what our policymakers should do. One is that all those key tools to alleviate poverty, to end poverty, the child tax credit being one of them, these are things that we know have a significant positive impact on the sleep of kids. This idea, if we alleviate poverty, we're really going a long ways to making sure we have sleep security. So all the things that we know work for poverty and the fight against hunger, for food security, all of these things are important. The other sort of easier fix is this idea of sticking with either daylight savings or daylight standard time. So whatever we think is best, stick with it. The big change is one of the things that has an adverse effect on a lot of our children. When we look at our region here in Houston, we know that there are over 34,000 kids that are living in zip codes that are these sleep deserts, where we know that these children are sleep insecure. And then when we look specifically at schools, where are the schools that we have red flags that if you're a policymaker, if you're a city leader, which schools should you be saying, wow, we need to do a better job of making sure these kids get sleep? We look at places like the Arrow Academy Charter School or Gardens Elementary in Pasadena ISD. All of these have very high mobility rates. And we know that there's a lot of sleep insecurity tied to mobility rates. 41% at the Arrow Academy mobility rate. It's really too high for these kids. So as we look at this big picture of sleep, one of the things that we have to understand is that in Texas, it's pretty simple. That kids that are sleep insecure are less likely to do well. They're more likely to be unhealthy. And what we need to do is make sure we do the policy, get the parents engaged. We need to understand the dynamics here. That if we want to make sure that every little Texan is successful, we're going to do some of these changes to make sure that our kids are sleep secure. So Sharon, from the viewpoint of sleep equity, this is a big deal here for us as well. So give us a little bit of a rundown there.
Absolutely. I appreciate the opportunity to shine a light on some of the equity issues as it relates to sleep as a basic need and as a human right. Currently, children in Texas decide how well they'll sleep. Without support from parents, families, and schools, kids won't be able to develop equally. And neighborhood factors such as light, noise, pollution, crime, and a sense of safety, access to green spaces or grocery stores, and segregation stemming from historically biased policies manifest in today's sleep disparities. As a part of this study, Children at Risk established a sleep insecurity index. This found that neighborhoods most at risk for sleep insecurity had considerably high rates of low-income families utilizing SNAP or food stamps, and a low rate of educational attainment that Hispanic and Black children were disproportionately represented in the highest risk communities. Our sleep index variables include these three components: low socioeconomic status, sleep environment, such as crowding in homes or mobility rate or homelessness, and individual level factors such as obesity, as you mentioned earlier, self-evaluated mental health, disabled child population, and youth workforce as well. And so we know that these disproportionalities result in inequities as it relates to race. And we did study those equities, and they're measured by the size or the difference, or rather the chasm between those who are sleep insecure and those who are not. And so we have to look at the challenges that children in sleep insecure communities face, because some of these are almost insurmountable without intervention from us in terms of our policies. And so I'm happy to discuss it further, but I would really love to hear from our experts as well.
Very good. Thank you, Sharon, very much. Let's go to Kendall. Kendall Nuno is the EVP over at Mattress Firm and has been our partner in this. Kendall, give us a few words of wisdom on this from your perspective.
Happy to, Dr. Bob, and I appreciate the opportunity. At Mattress Firm, we have long believed that everyone deserves a good night's sleep, and we've been highly focused on the sleep environment with a little bit more emphasis for adults. Ultimately, we know that the right mattress is the foundation for quality rest, but many other factors creating our overall sleep environment can affect how well we and our children sleep. And so we've learned that consistent high quality sleep is critical for a child's long-term health and development. Sleep prepares the child for challenges that lie ahead and helps them retain the lessons of the past. So like food, shelter, clothing, sleep is a basic need that we believe every child requires and deserves to have met. Every parent we know wants to be able to provide these basic needs and foster an environment for children to feel safe and secure. For these reasons, we've been proud to partner with you and the Children at Risk team to develop this project and this study. We know that Children at Risk is known for their focus on fulfilling holistic needs of children and examining the issues affecting child well-being. And so together, we wanted to understand how to improve the quality of sleep and in turn, the quality of life for Houston's children. We want all of them to dream big and grow into successful adults. So we're happy to be here, Dr. Bob, and we appreciate the partnership.
Thank you, Kendall. We're so proud of this partnership because, when you look through the lens of sleep, I think it broadens a lot of people's interest, right? Adults have problems with sleep and they know that it has an impact on their success. And so I'm so excited that Mattress Firm is interested in this and focusing on the holistic picture with kids. So thank you very much, Kendall. Charlie Roy is with us. She is the director of the Center for Social Measurement and Evaluation at Children at Risk. Charlie, I know you were the primary author of this study. What are some of the sort of key things for you that were most interesting as we look at the sleep study?
I think the most important thing was just the importance of sleep, not realizing how much sleep is linked to all these outcomes later on, just even early on, things in terms of children's behavior, level of anxiety, even like as little babies who have, separation anxiety or temperament issues, and then going on to later age, anxiety and depression around teenagers, and even suicidal ideation that comes out of lack of sleep, and that leading into other things. So just not the level of importance of sleep as a basic, part of your developmental need was just something that was very not well, I think it's studied, but it's not something we discuss often in terms of preventive health and what we can do to help children and adults. As Kendall was also saying, that we have known a little bit, a few things about adults, but not about children. And and this is a really great thing in terms of having the opportunity to look at this because of the support of Mattress Firm. We were able to do a pretty thorough job of looking at literature, what's the background research, what's been known from scholars who have looked at this. We went and met a lot of different regions of Texas, including Houston. We met with a lot of providers of services to children and got their expert opinion and ideas about what we had already known and what we weren't studying. So that gave us a little bit more depth into what should go into this index that both you and Sharon had mentioned. There's 11 factors, and we feel very strongly that the factors that go into the index are pretty rigorous, given that we had done a little bit, we've done robust research on lit review, getting expert opinion, even, sort of not maybe as rigorous, but even running it by parents and saying, like, does this, pass your litmus test for, what you see in your children and how things play out. So we feel pretty good about that. So those are, like I said, like some of the ways we went about it and some of the key big findings.
Yeah, Charmaine, one last question. I want to ask you the zip codes. When we look at some of these zip codes around the state of Texas, and certainly the ones in Houston that sort of make up our sleep and security map, what distressed you when you saw some of the results across our state around the zip codes?
So, I mean, the fact that there is a difference in terms of high risk areas and low risk, there is a 30% higher sleep insecurity in Harris County, if you look at different zip codes. So just being able to see the level of resources that we have in a big city like this, but then at the same time, their children in pockets that are, there's disparities, basically, that there's differences between the haves and have-nots. And some of our big findings were that, Houston has the third lowest rate of sleep insecurity compared to all of the other regions. So in terms of overall, the number of children in Harris County, that was only 3% of children, so about 30,000 children. So while we can talk about total numbers, but we can also say those that were affected very much, given all of the things that are going against them in terms of the risk factors, including, as we said, different things like children who are working. And we looked at up to age 19, so 16 to 19-year-olds. So it's a little bit over that 18 age for the youth who are in the workforce, but all the other things looked at children, housing security, and you'd mentioned earlier mobility. So mobility is one of those things where we look at children who are, going within a school year, changing school. So just the level of disruption any parent can imagine, and then that leading to sleep insecurity and grades and other things. So Houston on par, was pretty much with state average, but at the same time, I feel like there are certain things to keep them in mind, and we can definitely help the places that have high insecurity.
Yeah. Thank you very much, Charlie. And just a few pieces of data that we thought people would be interested in. I want to go to on the ground. We have Dr. Kimberly Darda, who is with Baker Ripley. And so, Kimberly, you're seeing this stuff on the ground. You're seeing what's happening. What's your take from the Baker Ripley perspective?
Well, first of all, good morning, and thank you for allowing us to be part of this revolutionary study. Our early Head Start program at Baker Ripley, we serve 3,000 low-income children and families in the southwest quadrant of Harris County and all of Fort Bend County. So one of the things that's different about the federal Head Start program is we provide our family resources through these direct content areas. One of them being health and wellness, which sleep falls under that area. We also provide education services, health and wellness, mental health, disabilities, nutrition, family and community engagement, and disability services. One of the things that's really important about sleep is we all know sleep is an essential function of the body, and it's just necessary for us to be able to regenerate and just recharge. And you kind of touched on that, Bob, when we talked about children and how important it is for children, and particularly those in the early childhood age. That lack of sleep contributes to impaired cognitive functions, and then sometimes there are social and emotional issues. So this can negatively impact the child's ability to learn in the classroom. So at Baker Ripley, we partner to provide those resources to our families through the Houston Furniture Bank is one of our partnerships that we use. And we focus to provide bed frames and mattresses and bedding for the children. So it's a culmination of resources. We want to make sure that our parents are advocates and they have everything that they need so that they can make sure that their children are successful when they go to school and they enter kindergarten.
Dr. Darda, it's so important, right? I mean, you and I spend so much time focused on making sure that we have a quality early education for our kids, right? Mm-hmm. Mm-hmm. We know that, well, it may not be the silver bullet. It's one of the closest things we have to a silver bullet to kids doing well. But if kids don't get enough food, if kids are homeless, and if kids aren't sleeping well, it's tough to get them that head start, isn't it?
And you hit the nail on the head. It's a head start. It's providing those families and the children the resources that they need so they'll have a head start when they enter into kindergarten. Because so many of our children and families, they need so many different resources. I touched on those 7 content areas that we focus on. However, the resources that we provide to our family goes way beyond those 7 resources. When the children come into our locations, into our centers, we want to make sure that the parents know how to advocate, and they know how to ask for things for their children. And we want to make sure they have every single thing that we need. So we pride ourselves with that. And just at Baker Ripley, you mentioned that we were, one of the powerhouse nonprofits in the area. We believe that our neighbors are bridges to opportunities and that we can transform the communities and that every single person has something that they can offer for good. And so we try to instill that in our parents too with our early Head Start program.
Kimberly, thank you so very much.
Dr. Bob, may I ask this question?
Sure, please.
Dr. Darda, this is probably the most timely topic, and it's the pandemic. And although we're doing well and feel like we're getting past it. I have to ask, have you seen an uptick in any issues related to basic needs in Head Start since the beginning of the pandemic? And what are you guys doing to address some of the things that kids and families need more of during the pandemic?
So my answer to that question is absolutely. Absolutely. So the pandemic was something, you know, I had never experienced anything like this, any of us, the pandemic, in my 25 years in education. So our families already had those basic needs and services that, you know, we provide to them, but we saw a need for employment resources, the rental, and the utility assistance as well. So one of the things that our parents were kind of relaying back to us is that there were local resources, but some of those resources were kind of saturated. And then there was, you know, limited funding. And then some of our parents, if there were language barriers, you know, they had a hard time seeking out and getting those resources. So we have family development workers and home visitors in our early Head Start program. So we focused and we made a strategic plan to continue to make sure that we had those updated resources for our families, because, you know, there was something that was changing. There were new resources that were available. So we wanted to make sure that our parents had all of the resources that they needed. So one of the things that we did to provide that was a community action fair. And so that community action fair was hosted by our Family and Community Engagement Department. And so now we do this annually. And what we did was invite about maybe 30 or 40 local agencies in the area. And they came out and provided our family development workers the services and resources that were available. And then they in turn can give those directly to our families at all of our locations. So I said we had 3,000 children. So we also partner with collaboration sites with the Houston Independent School District, Fort Bend Independent School District, and the Stafford Municipal School District. So those family development workers and the home visitors are the key to making sure that our family receive those resources.
Great.
By meeting
Thank
those
you.
basic needs, I'm sure you helped a lot of people get better sleep. So thank you.
That's the goal. That's the
Yeah.
goal.
Thank you, Dr. Darrow. Let's go para la prensa latina. Queremos hablar un poco en español. Estamos aquí con Guadalupe Fernández. Guadalupe, ¿nos puede decir qué es la cosa importante de que estamos hablando hoy?
Sí, hoy estamos orgullosos de presentar nuestro estudio titulado Descanso y Resiliencia, donde exploramos la inseguridad de sueño en Texas y en nuestra región aquí en Houston. Mattress Firm apoya el buen dormir. La comida, la vivienda, la ropa, el sueño son necesidades básicas que todos los niños merecen tener cubiertas. Todos los padres quieren satisfacer esas necesidades básicas y entienden la conexión, así como mamá siempre nos contaba. Es importante dormir para nuestro bienestar. El estudio nos muestra un número significativo de niños en Houston que no duermen bien en Texas y sabemos que perjudica el éxito de los niños y el éxito de nuestra región, de nuestras familias. Esa falta de dormir perjudica la salud y el bienestar de nuestros niños y nuestra región. La desigualdad y la disparidad del sueño en este estado y en nuestra región es muy alarmante, así como lo damos en el reporte. El reporte también destaca recomendaciones para asegurar el bienestar de los niños a través del sueño, así como recomendaciones para padres aquí en nuestras familias, para asegurar que nuestros hijos puedan dormir, así como establecer un horario regular para dormir, hacer el ejercicio, cenar juntos, así sanos como familia, asegurar que el ambiente esté fresco para mejor comodidad mientras duermamos y controlar el tiempo que nuestros niños estén usando sus pantallas, sus tecnologías. Igualmente, destaca unas recomendaciones de pólizas para apoyar a padres y familias en asegurar el buen dormir de nuestros hijos, así como pólizas que alivian la pobreza en nuestra región, que directamente contribuye la desigualdad del sueño, y seguir apoyando los recursos que existen en esta comunidad, así como Baker Ripley y su programa de Head Start, que apoyan a nuestras familias con las necesidades básicas que todos los niños merecen. También las pólizas que eliminen las barreras para que las familias puedan acceder a las necesidades básicas para poder apoyar el buen dormir.
Gracias, Guadalupe. And for those of you who don't know Spanish, Guadalupe did a better job in Spanish than I do in English. So I'm just saying. So, muchísimas gracias. Y son cosas muy importantes para la familia. Sí. As we wrap up, Kendall, from the perspective of Mattress Firm, it seemed like a natural thing for Mattress Firm to want to focus on this, but it's not every corporate citizen that stands up and says, we want to make sure that we look at the whole child and the success of children. Can you take us through just a little bit of that, in 30 seconds? What was the impetus, around this? Because we're so excited to be able to look at the world of children through this lens of sleep.
Happy to talk about that, Dr. Baum. The partnership at Children at Risk was natural for us. There's long been conversations, as we've noted on this conference, about food and shelter and other areas of insecurity for children. And we all want children to grow up into healthy and successful adults. Mattress Firm has been focused on the conversation about sleep, and we just really wanted to understand, where does that challenge start? Does it start in adulthood, or does it start with the child? And we believe that there's an importance of ensuring that that quality of sleep for our children starts at a very early age. Sleep environment, getting that big kid bed, growing up knowing about the importance of sleep and the impact that quality sleep can have on you and your success in life. So we just thought that it was time to start this conversation. It's been ignored well too long, in my opinion.
Yeah, interesting, right? So thank you, Kendall, very, very much for the support of Mattress Firm. Thank you for being here. Dr. Darrow, thank you very much for being a part of this, and we thank everyone at Baker Ripley for the great work that they do. Thank you, Charmely, Guadalupe, Sharon, for all the great work that's going on here. And if you have any further questions from the media, feel free to reach out to any one of us. We're happy to help, and we're happy to talk about this more. And we'll continue doing these press conferences around the state today and tomorrow, as we focus on making sure that every little Texan gets the sleep they need so they can be healthy and academically successful. Thank you all very much.
Thank you.